Hello, my name is Antonewa. I'm a UK and US trained endoscope consultant and neurologist. Today I'll be going through how you can conduct and process a lateral flow test or a rapid COVID test for taking salivary samples. In the previous video I have shown how you can do it by taking nasopharyngeal swabs. This time it will be using salivary samples. First step will be to rinse your mouth out and make sure you just give it a good swirl or rinse your mouth out properly. The second will be to get some sample from the throat. The throat secretions is ideal, either in form of phlegm, which you cough up, or just clear your throat and produce this and spit into a receptacle or any container that is clean and pre-sterile. I'll show you that. I previously rinsed out my mouth before doing that. Then you want to take a sample. Ideally, you want to take a sample from here with the pipette provided. Is this. And you only need very little, about 3. So you squeeze it and then bring it up into your pipette. And then from hence, you open up the secretion reagent. So you open it up like this. And I have to point out, I've previously washed out my hands. You could wear gloves or wash your hands thoroughly before doing it so you don't contaminate the sample. So I put it inside there and drop some of the secretion inside there. And this comes with a cap from the manufacturers. So once you fill that, you apply the cap. It fits like that, and you give it a good shake. Make sure it mixes properly. After mixing, you now pour it into the receptacle at the place point here. I'll bring closer so you can see. In there, like so. Also a few drops will do. And then you wait for reaction. Now, as you can see, the filtration is already beginning to rise. What you're waiting for is to see if there's a reaction. If there's no bar at all, then you've done the test incorrectly. If there's 1 bar, it means it's negative. And if you have 2 bars, it means it's positive. You wait for about 20 minutes or 20-30 minutes for the results to show. And you can already see there's a bar appearing on the specimen, which shows I've done the test correctly. If the second bar appeared earlier, that would show it's positive. In that circumstance, you need to self-isolate for 10 days or receive treatment if required. You can observe that the test has already shown a negative response in barely 10 minutes. And that's how easy it is to do. I hope you found the test helpful. It's ideal if you are coming to the office to see you or close domestic staff. It's also ideal for events. If there's going to be a large amount of people there to know who's got COVID. It's also useful in restaurants, anywhere there's an enclosure, boarding schools, pre-admission, even your domestic staff. Ideally, this test should be done twice a week, just to ensure that you have a good way of identifying those patients that may potentially be carrying the infection.